Hi, I'm Dr. Rahul Gupta, interventional cardiologist at Apollo Hospital, Navi Mumbai, and I'm in conversation with PharmEasy. Together, we are going to discuss the best practices for good heart health. So, when we are talking about heart disease, today we are discussing more about the coronary artery disease, the blockages symptoms related to the heart disease. So, the most common symptoms anybody suffering from heart disease would be breathlessness on exertion. So, somebody is walking and he feels breathless and he has to sit for some time or relax for some time, could be a heart symptom. Similarly, palpitations, fast heartbeat, heaviness in the chest on walking, choking in the throat, pain in the jaws, pain in the back which comes on exertion and goes away with the rest. All these symptoms could be related to the heart disease. Similarly, swelling over the feet is one of the symptoms of the congestive heart failure, where the heart is not pumping in a good way, effective way. So these are some of the very common symptoms which all of us should be aware about. The most important thing which we have to pay attention to is that anything which comes on activity, more than usual activity, and for which a person has to take rest, is very likely to be arising from the heart. So these are the symptoms which we need to take care. There are various kind of tests which you should do on regular basis to see whether everything is all right with your heart. So there are tests to know what are the risk factors present inside you which can cause heart disease in future. So you should have your cholesterol values, which you should know whether they are within normal limits or not. Your sugar values, because high sugars can cause heart disease. Similarly, your blood pressure values, whether blood pressure is within normal limit or not. Your weight, and then there are certain tests which tell us about what is the present status of the heart. So like ECG, 2D echo and stress test. ECG tells us about the electrical activity of the heart. 2D echo is like the sonography of the heart, which tells us how the heart is functioning, how the valves are functioning, how is the layer around the heart which is functioning, whether it is all right or not all right. And TMT is something which tells us about the possibility of a blockage in the heart. By TMT I mean a treadmill test or a stress test, popularly known as stress test. So where we make you run on the treadmill and we see what happens when the heart is beating at a higher rate, whether it functions normally or whether there is some abnormality which comes up in the form of ECG changes. So these are the common tests which we like to know for anybody. So your cholesterol, your sugar values, your weight, your blood pressure values, and the other tests which I have told you.